Good afternoon. I'm excited to bring you another episode of Midlife Momentum. Today we're going to talk all about your gut bacteria, and what really happens down there, ladies, as we go through midlife. And I want to introduce my guest, who's amazing. I think of him as the gut guru because he's just, but he might not like that name. But if you ever need that, he's written this new book, Immune Reboot. And Dr. Silverman, I just want to read your bio so I get it correctly. Dr. Robert Silverman is a chiropractic doctor, clinical nutritionist, national international speaker, author of Amazon's #1 bestseller, Inside Out Health, and founder and CEO of Westchester Integrative Health Center. He has a Master of Science degree in human nutrition and 5 other designations in clinical nutrition. The ACA Sports Council named Dr. Silverman Sports Chiropractor of the Year in 2015. He has over 2 decades of clinical experience, and Dr. Silverman is a widely respected thought leader in his field. And I also know Dr. Silverman's new book, Immune Reboot. If you could pick this up on Amazon, correct, Dr. Silverman?
Yes, you can. Thank you.
I've podcasted with Dr. Silverman before on the Muscle and Fitness Plus podcast, which is where I met you first. And also at A4M, we've heard you've spoken there several times, the American Academy of Anti-Aging. And welcome.
Thanks for having me. I'm excited to be here. This is going to be a lot of fun. I just want to start off by saying we talked about some of the topics, and full disclosure, I am happy that we discussed the topics before. So people know that when you have a podcast, you don't come on cold. You want to cover certain things because you want a pointed, fluid conversation. And I have to say, I'm happy that I did that because the depth of your knowledge and the depth of what you want to share with people to digestible bites is outstanding. I'm not going to tell you how many people I asked, and now I know who knows what about what. We're going to leave that alone. But that was great. And I'm excited to share some knowledge bombs with all your, what'd you call them, midlife ladies, the perimenopausal women. My wife's 51, so guess what? I get it.
You get it.
I get it.
I know. It's a crucial time. And it is my demographic. I'll be 56 on Sunday. And
Okay.
Thank you. But even women in their 40s, it's interesting because when I was in my 40s, I had no clue about any of this. I wish I wish there was someone out there like me that I would have followed and to understand, because I would have done a whole hormone panel back then to see my baseline, but I never did any of that. No one ever said to do that. And it wasn't really until I hit probably 53 that things started happening. Lots of joint aches and stiffness. Sleep, always been a good sleeper, but now, tossing and turning and waking up. Not so much hot flashes or night sweats, maybe periodically, but not consistently. But just like the body stuff, the aches and pains and the fatigue and not feeling like myself, because I'm always in the gym, I'm very energetic, and then having to sort of pry myself out of bed in the morning and drag myself into the gym. I'm like, this is not me, like what's happening? So it really made me take a deeper look into my own health. And then I realized, hey, women need to know this stuff, and they don't. And I talk to them every day, not just my clients, but people in passing or at events. So it'll be great because talking to you about gut health. And I think the very first question, very simple, should be, because I hear this a lot, what is the difference between a prebiotic and a probiotic? And then we can talk about some of the nuances, like, do they have to be refrigerated? I've read things where if you buy them on Amazon, the active cultures might not even be active. They could be dead. Like, there's a lot of things that you hear. So first, let's start with the definitions from you, and then we could talk about how to find a good one and how to know the difference.
Well, that's a great question. First off, you said 53. The average woman goes through menopause at 53. So this is the first time in your life that you are average. So we'll target the 50-year-old woman in that range. So brief overview. Prebiotic is the food to feed the probiotic, which gives life. So prebiotics are non-digestible carbs serving as food sources for probiotics. Some food examples of them are asparagus, Jerusalem artichokes, chicory, garlic, onions. These prebiotics aid in the absorption of certain minerals, calcium, zinc, iron, and they also decrease appetite. Interestingly enough, studies have shown that prebiotics probably are much more important now than probiotics. So you've got to either eat or take a prebiotic to feed a probiotic. Studies have shown that prebiotics decrease body weight, body fat, truncal fat, something called interleukin 6, which is an inflammatory marker that you can get on any quality blood test, decrease serum triglycerides, increase bile acids. We talked about that before we went on, and increase good quality probiotics. Ultimately, the health benefits of a prebiotic are gastrointestinal health, bone health, weight management, metabolic health. Now, probiotics are interesting in that they're vastly different in that they are and should be live organisms. So they give life. The problem with the probiotic, and I think you alluded to it earlier, was the question is, are they live? How many colony-forming units? What is a probiotic and which one should you take? The basic breakdown is genus, species, and strain. So let's take Lactobacillus acidophilus, and we'll call it NM3. I'm going to make up a strain for you. Lactobacillus is the genus. The species is Acidophilus. The strain is NM3. It is a strain-specific organism. The strain will tell you what function and what properties you're going to benefit from growing it or losing it. So when people look, you really don't want to see a probiotic where it says proprietary blend. That's like a videotape that you were supposed to use in the OJ trial, and it just never showed up. So no bueno. So prebiotics lead to a probiotic. And one more thing, I'm going to put one more little morsel of information on the table, in that the pre plus the probiotics lead to what we call a postbiotic. These are metabolites that are left over. And that's really the most important thing, like a short chain fatty acid, which is very salubrious for people's overall health. And also a postbiotic of note would be short chain fatty acids like butyrate.
Okay. So the prebiotic, the foods that you mentioned, the artichoke, the asparagus, garlic, onions, does kimchi fall into that area? Is that where?
Let's talk fermented foods also. So, we had a conversation with a couple of my friends about fermented food. And here's the question. Is a fermented food a pre, a pro, a post, or all the above? And it was great because here we have all these people that lecture at A4M, and I'm like, answer the question. The answer to the question is it's all the above. Now, remember, that's a fermented food that isn't pasteurized. So when you go into a store, my Jewish delis, God only knows what they did to it. So your sauerkraut, your kimchi, like you said, your kombucha, your dill pickles, these are great choices. Your pickled onions, that's what you want to eat. You want fermented foods, miso.
Okay. Oh, so pickles count. Someone asked me that, and I'm like, I'm not sure, but I think they would. But
pickles do count. It's the pickling.
Okay.
So it's a cucumber, and it becomes a pickle because, as you know, we pickle it.
Okay. And then
sour pickles taste better.
Pickles are awesome. I'm gonna start eating more pickles. Kimchi. Absolutely. I have my daughter's big on eating kimchi, and it's in the fridge. And I like garlic. I like onions. I like cabbage. I like all that stuff. But I opened the jar, and it's very strong. I tasted it once, and I'm like, yeah, it's okay. But I'm trying to figure a way that I can eat it because I know how good it is and incorporate it into something. Maybe throw it in a salad. I'm not sure. But do you eat kimchi?
I do. We're very fortunate that we actually get authentic kimchi. Somebody in the neighborhood is Korean, and my wife is Southeast Asian. They kind of swap dishes. So we get the kimchi, and she makes it herself, and it is delicious. I strongly recommend it. It's really hard to find a lot of health stores, and that also probably goes to maybe the number one thing that women in your age bracket going through these proverbial changes need to do is they may have to start cooking for themselves. Yes. Because it's really hard to get the kind of food that you need to support the changes going on in that midlife transition, if you will.
Absolutely. And I know living in the time period that we do where you can Uber Eats and have everything delivered to your house. Right. One of the things I come up against a lot with some of the women I work with is they'll say, well, I don't like to cook. And I'll ask them, I'm like, you have kids, right? Well, they're in college now. Well, at one point though, you did cook for them. Like, you have to cook for yourself. You need to know what you're putting in your food. And if you're ordering out all the time, it could have inflammatory oils in it. And, you just don't know what they do in the kitchen. Even if you think it's organic or whatever it is, you really don't know unless you're in there seeing what they're using for ingredients. So I eat out very, very little once in a while and I enjoy it, but I tend to make most of my own food. So
Agreed.
I think that's important. But I want to go back to the pre, post biotics. So if a woman, say she's, in Whole Foods pushing her cart through and she's going down the supplement aisle and you get to they have the little refrigerated case in Whole Foods, right? They have Jarrow in there and all the other brands. What's a good one? Like how many million trillion particles, or like what's the minimum number you should get? There are a lot of choices and it
There are a
can
lot
be
of
confusing.
choices. There are a lot of choices. So they call it colony forming units. So you want colony forming units in the billions, not the millions. You really need a lot. You need as what they would call a surfeit amount, just a lot. So that would be number one. Number two, probiotics do not need to be refrigerated. They need to be room stable. But
Okay.
here's the problem. When you think about the transport of them, that's where they may die off. So certain transport organizations, and they're way too big for me to mention their name and to take a shot at that, don't have heated trucks or cool trucks. So the change in temperature can really offset any of the benefits. So again, I wouldn't buy something off the shelf. So when I get a probiotic from some of my professional brands, they come and they use UPS. They're also encased in ice, just so they're temperature stable. So that
Okay.
would be number one. Number two, you do want to populate with a lot of different probiotics. So when people say, I've been taking this one, it's really done a good job for me for the last 4 years, it's a bad answer. What you want is you want biodiversity. You have an ecosystem down there and you want to populate that ecosystem and you want to populate it with biodiversity. The reason for biodiversity is very simple. The more strains that you have, the more health properties you can pull from. So in your neighborhood, the more that you have the people who can do different techniques, like if you have a neighborhood of a plumber, an electrician, a painter, you can get your house done a lot quicker. So I'm a big believer in switching your probiotics every 3 months. Now, the question will be asked, I'm sure at some point, so let's just get it over with right now. Which probiotic or which strain do you like? Well, the genus and the species, without question, would be the following: Lactobacillus acidophilus, B. lactis, Bifidobacterium lacti, L. reuteri, and L. raminosus. Those are great choices for women who are going through menopause or perimenopause, whose estrogen is dropping because they have a function to help estrogen upregulate.
Okay. Great. That's a good answer. I'm sure people will be going back to write all those down, but that's really, really helpful. Let's touch a little bit on, and it's something I just learned about at the last A4M that I went to, Acromania.
Mm.
Now, is that a type of pre, pro, post biotic?
That I would classify that as a probiotic.
Okay.
Now, Acromania, I call it Wonder Woman. She does everything and she looks good. So it builds up your intestinal tract. Acromania is really shown to have great immune boosting. And maybe that's one of the biggest things for probiotics. They have an immune boosting modulation effect. More so than that, Acromania over a 6-month period has shown to decrease hemoglobin A1C, which is your average blood glucose marker over a 3-month period or so. So there's some data that indicates that Acromania has dropped that number 1 point. So just as a point of reference, and I don't have any affiliation with Acromania. I carry it in my office. I don't own the company. I don't work for the company. There's some new companies that have come out with it. Everybody knows to date, Pendulum is the only one that has Acromania. So if you have a 6.3 or a 6.4 on your hemoglobin A1C, that's high. You would virtually get pre-diabetic into a diabetic. 6 months later, you're at 5.4 or 5.3, not only do you have a good hemoglobin A1C level, what's interesting about it also is that at 5.4 or less, your brain doesn't shrink because blood glucose damages your brain. So probiotics have a positive effect on the brain. And so much so, certain probiotics now are called psychobiotics because they have a great impact on the proverbial mental health symptomologies.
Okay, excellent. And then with
Not
some,
implying, I don't mean to interrupt you. I'm not implying that women have it. I'm just saying because my wife says that I should take psychobiotics because I'm the problem child.
so can someone just take Acromania and not anything else, or should they take the other lactobacillus and the other ones you mentioned and Acromania, or you could do just one of the, or you could just do Acromania?
It's a great question. Again, as long as you have some probiotics, I like to choose from a plethora of different probiotics. Hope I said prebiotics. As long as you have the prebiotics, I always like to take some probiotics, and I usually take more than one of the strains. So
Okay.
feel free. You're not going to overdo it. No one's come in my office and their gut was in too good a health.
Right.
That hasn't happened yet. No one's come in my office and I was like, wow, you got a problem. You have too much good bacteria. I mean, like you said, where we live, the process and transition that the individuals are going through are putting them at an inherent health disadvantage. Male and females, the ingestion of gluten,
Mm-hmm.
sugar, fructose, dairy, environmental toxins. Don't sweat it. Don't worry about it. You're not going to overdo it. By the same token, don't take 20 different probiotic bottles at one time, but I haven't seen anybody do that yet.
Not a problem yet. So yeah, you'll let me know if that ever happens.
I'll call you. You'll be the first one.
So let's talk a little bit about leaky gut in midlife and what happens, why that happens to a woman regarding her estrogen levels dropping, and what happens to her tight junctions, and that gut integrity sort of starts to erode a little bit.
It's a shame because as we were talking before, I talked about estrogen being like the evil sister.
Mm-hmm.
But I'm not sure progesterone is the good sister, the genie yet. Um, what's fascinating as women go through the perimenopausal state, as we all know, estrogen decreases. And what we found out that the decrease in estrogen also coincides with a decrease in biodiversity, and not only just biodiversity of the bacteria in the gut, but also a decrease in good bacteria. Interestingly enough, good bacteria levels decrease dramatically during that time period, which increases the risk of bacterial vaginitis.
Mm-hmm.
That indicates that women also get more yeast infections, i.e., candida, and also more instances of leaky gut.
Okay.
So that poses an issue. That perimenopausal, and they extended in a couple of articles that I read from 45 to 60. That is the bullseye for women to have a leaky gut. So why is a leaky gut a problem? Well, 80% of your immune cells are in your gut. It's where your macro and micronutrients are absorbed. So a lot of women complain about the estrogen belly, the little menopausal belly, and everything like that. That belly may be directly attributed to the change in the hormones, but the inability to digest certain nutrients. Hence the idea, if you can't digest a nutrient, you're going to store its caloric content. Therefore, you're going to get a little bit heavier looking. Plus the fact estrogen is so nasty when it decreases, it also dramatically decreases muscle mass, our longevity organ. So obviously one of the first spots that women will see a loss of muscle mass is in the tummy and in the hips.
Right. And that's always a problem area with women. When I talk to them, they'll say, I think some of the terminology is muffin top, or, my waist, all of a sudden I have this soft belly, loose skin, or I'm holding on to weight that I never had before. Some of them are bloated. Some of them are, carrying subcutaneous water, and they're just not feeling, they don't feel the way they used to. They don't look the way they used to. And for
Same
me,
for men.
it's going through their lifestyle and seeing, because many women are drinking too much alcohol too. A lot of women are still drinking 2 or 3 glasses of wine a night, even still, like coming off COVID, I talked to women. I know it's been a few years, but there was a lot of alcohol consumption during COVID, and people created these habits that still carry forward even now. So it's a matter of getting them off, off alcohol and looking at their lifestyle and making modifications there, because it really does affect their gut health, their immune health.
Alcohol consumption disrupts both the digestion of sugars and the balance of bacteria in the gut. It also leads to a shift from gut's normal diversity, causing, again, yeast overgrowth, candida. Really underrated. Small intestinal fungal overgrowth is on the rise.
Yep.
Alcohol, shocking as it may seem, damages the lining of the intestines. So drinking can cause the lining of the intestines to be too thin. And lastly, as we all know, drinking affects the liver. And as you'll see, for the breakdown of estrogen and the recycling and elimination of estrogen, there's a gut to liver pathway that needs to work appropriately. And alcohol puts a real screeching stop to all that.
And what is your opinion on alcohol consumption? Because they change it all the time. They'll say a little bit of red wine every day is good. A little bit of 4 ounces of alcohol every day is good. There's the thought behind it that it's a blood thinner, and and they use it from that perspective. But my personal opinion is it does nothing good for us. I mean, we all partied in our 20s and 30s, probably until we had kids. I know I did. And then in my 40s, I cleaned up my act and I really stopped drinking. Very, very rarely I'll have a glass of champagne. If I'm somewhere nice and I want to have one glass of champagne, I'll do it. But I don't think, in my opinion, especially as a nutritionist, it doesn't do anything good for us as we start to age, especially if someone's hot flashing or night sweating and having a hard time sleeping, and they're drinking wine at night to take the edge off, calm down, de-stress so they can fall asleep. But I'm like, you might fall asleep, but you're going to wake up and then you're warm and you're flushed and you can't get back to sleep. So, but I'm curious what your opinion is as far as consuming alcohol.
I agree with you, and it's real funny. I have this acronym: DNA, no dairy, no nicotine, no artificial sweeteners. The A used to be alcohol. The problem was when I took alcohol from everybody, and you probably know this already, all my patients left because, as you know, everybody wants to have a little bit of a sneaky peek.
I know.
That said, I don't know that alcohol really does anything substantially beneficial for you other than makes you happy. So I would agree with you. I would limit the alcohol as much as you can. But as I said before, taking it away in elimination, I don't drink. I haven't had a drink in 40 years. Mm-hmm. I wasn't a drunk. I drank, didn't like it. Nothing worked out. Lost a girl that I liked, lost my job, was sick as a dog. I said, I'm out. But nevertheless, alcohol is not really it wouldn't be on anybody's health promoting list. I hear some people say, well, it's got resveratrol. You need about 84 glasses of resveratrol. So if you can drink that many glasses, you've earned the right to drink. Other than that, slow down just a little bit.
Go buy a resveratrol supplement if you need it, if you're deficient in that. I've never heard anyone say they are.
On the two of us, without question. Without
I
question.
know. And I'm the same way. I'll talk to women and I'll always say, if you can keep it to like 1 or 2 glasses of something a week, then they'll ask me, well, is vodka better? And I'm like, well, I mean, I guess it has less sugar than wine does, but I mean, is it better? I wouldn't say it's better, but I guess if you had to choose literally your poison, I'd probably stick with the clearer alcohols like vodka or tequila or something like that. Not that I'm condoning it, because I'm not.
I hear you. I hear you.
But yes, so I know we touched a little bit on yeast, but I do want to touch a little bit on, we talked about this before we hopped on, but many women in menopause, perimenopause, do develop a lot of urinary tract infections. And then many times the doctors will throw them on copious amounts of antibiotics, which is not good for your gut health. So let's discuss that a little bit too, as far as how doctors tend to be a little bit antibiotic happy, as far as always throwing people on a Z-Pack or this or that, and and what that does on its own. But if someone say they really have to take an antibiotic for an infection, will using pre and probiotics help negate some of the damage?
Well, let's take the overriding theme that you said.
Okay.
Essentially, women, and then let's get to the probiotics, the
Okay.
prebiotics, the antibiotics, and the such. Basically, you said that there's an increase in UTIs in women from 45 to 60, and that's correct. And the reason is that because of the losses of muscle mass, the urethra widens and open up more. That gives more room for the bacteria to come in, go through, and get up the urethra. So that's the reason why women have a UTI increase, because of the loss of muscle mass from estrogen. Loss of muscle mass, ladies. You know, it's funny. I go into the commercial gym every so often, and I'm not trying to divert, but they're on the cardio machines, and that's fine. I mean, it has a place. But if you're going to do one thing, in my opinion, and you're the expert on this, 50% or more of your workout should be based on some sort of strength training. I know women, and you're really in shape. You lift. I think you lift almost every day. Women typically are too afraid of getting too muscular. I have to tell you, it's been rare that I've said to myself that woman's too muscular, and that doesn't, and I don't date necessarily bodybuilders. So women have to get in, especially from 45 to 60, and get a good weight resistant program. Now, segueing from that UTI to antibiotics, I'm not anti-antibiotic, if that's not a dangling partisan.
I know, right?
But they have their place, and they're actually created for women who had to give birth and were dying from sepsis. So again, but antibiotic, understand what it is. It's that it blows up all your bacteria in your gut. So one Z-Pack will damage your quality of bacteria for 6 months.
Okay.
So for me as a male, if somebody said to me, you have meningitis, would you take an antibiotic? Yes. As a chiropractor, if you had Staph aureus and I'm going to cut a chunk of your leg out, yes. Mm-hmm. Would you take it for a viral infection? I doubt it very, very much. So I'd be very careful with the amount of antibiotics that I would take, because they do build up over a period of time. Now, what do you do if you've taken an antibiotic? Well, you kind of gave the answer already. Pre and probiotics, you got to feed the beast, you know, and you got a 6-month period where you really have to repopulate somebody's gut after an antibiotic. Again, I'm not negative to it. It saves lives. It has its place. It's just, I think, sometimes used a little too frequently, and people don't understand some of the side effects to it.
No, and that's important. I didn't realize it was 6 months, that it takes that long to repopulate. And, you know, people could get sick many times within that 6 months. And sometimes they're just kind of cycling antibiotics because they're not getting better, or one's not working and right. So that's really important to know. And I'm with you. It's, of course, you know, sometimes we need medications to get better. Absolutely. But I do think sometimes they're a little overprescribed for some things, but I'm with you as far as that goes. All right. I'd like to jump into a little bit of, in your opinion, on this question, because I hear this a lot. Women in midlife have a lot of constipation issues. Mm. And in your opinion, your professional opinion, what is the best way to manage that? Is it throwing more fiber at it, like a psyllium husk or something, or a calm, as in like a magnesium citrate product? The probiotics, the prebiotics, those things. So I'm curious, is it a culmination? Like, in your opinion, what's the best way when a 50-something woman comes in and says, yeah, I go to the bathroom like once every 4 days? And that's problematic, because now they're not ridding that recycled estrogen that they should be getting rid of. So
correct. Well, again, the decrease in the estrogen hormone leads to constipation. During menopause, the pelvic floor muscles weaken, don't allow them to eliminate quite as effectively. You said a couple of the great things: more fiber. The average American consumes 8 to 15 milligrams of fiber per day, grams of fiber per day. You need 35 to 50. A 10-gram increase in fiber leads to a 20% decrease in mortality. So fiber is a great choice, both soluble and insoluble fiber. Also attributing a lot to the constipation. Women decrease their activity, just don't feel well. They don't have the energy. If anything, this is the time in our lives we're supposed to exercise more efficiently. When we were young, our bodies were more resilient. Also, believe it or not, a little factoid. Women's colons are 10 centimeters longer than men. So that little change and that little bit more space to travel really leads to a constipated young woman. So drink more water, water with lemon, get physical activity. My elixir of life, coffee, and of course you can do some aloe vera juice. And you also said magnesium citrate. Great
Yes.
choice. 800 grams of milligrams of magnesium citrate will turn you into secretariat real fast.
800 milligrams. All right, that's good to know.
800 or more.
Okay.
And a lot of people are now using, a lot of gastroenterologists are using high levels of magnesium citrate as a prep for a colonoscopy.
Interesting. Yes. Yes. Actually, that reminds me, I need to schedule my second one. I've got to do that. It's on my to-do list. But it is important. I've used products like Calm with women, the powder. Will a magnesium citrate capsules work as well as a powder? Do you have a preference on which one?
I don't have a preference. I mean,
Okay.
the powder is easier to get, a higher dose. It's usually a little bit more concentrated. It's really whatever the patient is more comfortable with. Some people don't like to swallow pills. Some
Right.
people don't like powders. So in my office, I carry both just so I have the option for the patient. I've always told everybody, I actually become a good doctor when you're compliant with my suggestions, and I really stink when you don't listen to me. So make your mind up if you want a good doctor in front of you or not.
And I want to, I know this isn't on the list, but I want to sneak this in
Go
as
for
far
it.
as what's your opinion on greens powders?
I love them. You know,
Okay.
I don't tell you why. I am pro fruit, but I'm negative to fructose. I hope that's not an oxymoron. So I like fruit, I like berries and stuff like that. I mean, all fruits taste good because they're sweet. Yeah,
Right.
well, sugar works with the reward center of the brain. I get it. So the problem with sugar or too much sugar at one time is it converts to fructose. Now, fructose is pretty evil in that it's quite deleterious to overall health. Fructose is the number one reason for the rise in uric acid. Fructose is the number one reason for the rise in non-alcoholic fatty liver. Fructose will shrink your brain. Fructose is the fat switch. If you want to gain weight quick, eat enough sugar and you will gain weight quick. Sugar, fructose, is the reason for elevated cholesterol. I just was on one of my high school, I went to specialized high school, my high school Facebook groups. And they're like, oh, my cholesterol's elevated. The doctor told me not to eat fat, not to eat cholesterol. Give me a break. I
I
feel like
know.
Lane Norton now. Give me a break. Are
I
you
know.
serious? 15 to 20% elevation of cholesterol from dietary cholesterol. The other 80% is from sugar. So the reason I like Go Green's drink is it's concentrated with the nutrients, but not concentrated with the sugar and the calories.
Okay. So, well, let's touch on the fruit a little bit because
Mm-hmm.
my thought process, I eat berries in the morning, I'll eat an
Mm-hmm.
apple periodically, I eat grapefruit, and I know fructose is sugar, but
Mm-hmm.
fruit also has fiber and antioxidants and phytonutrients and all those good things
Correct.
too. So it's like I've never really met anyone that's overweight because they eat too much fruit, but I was always under the impression that it was more the high fructose corn syrup when they really, process it and make it that the high fructose corn syrup goes through a whole different process once it gets into your liver and really converts to fat like that. So, and that
Correct.
high fructose corn syrup is in everything. It's in crackers. It's in, I mean, you look at ingredients, it's like, why is there high fructose corn syrup in a cracker? It's kind of interesting.
I agree with you in the high fructose corn syrup. That's actually 17% of the caloric intake in the average American.
I
And
know.
that's why I said I like fruits. I don't like fructose. Right. You just made a valid point. The fruit comes with fiber. It comes with polyphenols. It comes from antioxidants. So you can eat fruits, and the ones that you mentioned are great choices. They're very health promoting versus damaging. However, you don't want to eat too many fruits at one time. You know how many grams your gut absorbs of fruit per time at a time? net carb, if you will. It's only 5 grams. So after the fiber and everything, so you can have a cup of blueberries. I don't
Right.
know if I would have a bowl
Yeah.
or a larger dosage of blueberries. So I am pro
Right.
fruit. I just think we need to watch our fructose. So, I'm out with people and go, I'm on a diet and I'm having a fruit salad. And I'm looking at them and I'm like, you're turning on your fat switch. I don't get it, but you're eating dark chocolate. Chocolate isn't good for you. This is 90% cacao. It's organic. This is an excellent choice. It has medicinal effects.
Okay. No, that's good to know. I'm glad you're pro fruit because I am
Makes you feel better.
I I have my favorites. And I know this also is not on my list, but I was all these things come into my head when I talk to you and it's because it's things that people ask me and I have, my 50 something clients all have kids. We all have kids the same age, they're late teens, early 20s and birth control pills. Can we touch on
Mm,
that just a little bit? Because my daughter, when she started going to her doctor on her own once they turn 18 and they can go in on their own, even though I always still go in with my daughter, not my son, but she went by herself one time and I said to her, if the doctor mentions birth control pills, you tell her no. So she came home and she's like, you were right. She asked me if I wanted to go on the pill. I told her my mom said no. And they're really quick to throw these girls 15. I talk to people, their daughters are 15, 16. They're on the birth control pill. Why? To regulate their periods and then to clear up acne. And that was why she recommended it to my daughter because my daughter breaks out a bit. And that just floors me because of all, what they're doing to their hormone balance. It's such a young age. And then,
mm.
and they'll be on it until maybe they want to try to get pregnant. So can we touch on that a bit? Because a lot of women that'll listen to this have daughters in this age bracket. And I really want them to understand that it's not a good choice.
Yeah, it's not a good choice. I think it's women 35 or older. It thins the blood vessels in their legs, makes them more susceptible to blood clots. Um, it's elevating ladies' estrogen at a time where their estrogen is pretty high. I mean, the 17 and 18-year-old, she is raging.
Mm-hmm.
So I would limit the exposure to that as much as I could. I haven't read any really good studies that they're health promoting. So I'm in accordance with you on that.
And how does because the birth control pill shuts off your natural production of hormones, correct? Now it's synthetic. It's controlling when you get your period, or some of them you don't even
Correct.
get your period. Like you'll only get it once a quarter or something like that. So, in your opinion, are there what are some good birth control methods for a woman that is in a good relationship, ladies, that that wants to prevent maybe not getting pregnant right away? Do you support using a Mirena IUD that secretes progestin? That's just more. It's not systemic. It's more localized, or
Over birth control pills, sure. Um, Condoms, the
right?
age-old protector, the barrier system.
Okay.
I know the guys are going to kill me when I say all these things. I can imagine when this podcast comes up, why did you say anything? You're supposed to say nothing, blah,
Mostly
blah,
women are
blah.
probably going to listen anyway. So
That's okay. And the women will be cheering for me. So, you got to even it out. I think those are great choices. I, I,
okay.
I, I think that's fine. And, it's really tough um, on you ladies because that estrogen up and down is much worse than a testosterone up and down. We have to go so much higher to have like that testosterone rage.
Right.
Just a little change in the dial on estrogen with the ladies in it, and it's really, really tough.
It is.
Um, and your hormones are so different. So, for instance, not to get off topic, but women are much more susceptible to, let's say, a concussion. So, you have a daughter, she's probably athletic. A lot of people have daughters that are athletic. People themselves are athletic. They can be car accidents. Women much more susceptible to concussion. Why? Because pound for pound, women are strong as men from the waist down, but they're not quite as strong from the waist up because you guys have breast tissue and men typically don't have any breast tissue. So your head whips back and forth more. So you can have a more involved injury. In addition to that, women have an issue with what we call microglial cells. So don't leave. Hold on. There's something called macrophages in our body, and they clean up the debris. There's something called microglials, which are macrophages of our central nervous system. Our brain is part of our central nervous system. Well, women have a tendency to stay in a more pro-inflammatory microglial phase. They call that M1, and are able to switch to the anti-inflammatory microglial phase, which is M2. Therefore, once microglials are stimulated to clean up cellular debris after like a concussion or a whiplash,
Right.
you stay in an inflammatory state much more constantly and easily than men do. So again, that's based on estrogen beta receptors. So like I said, I really believe that estrogen is the evil sister.
It is, but we need it for so many things too, especially as we lose it. I mean, we need it for the cardioprotective effect, the bone density, and again, like you just were talking about, the cognitive health too, and keep protecting our brains.
It's funny you say cognitive effect. There's a great little factoid. Women have higher HDL, which is good cholesterol, compared to men because of estrogen. So that's one spot that you win on the hormone.
But it is, and you touched on testosterone a little bit too, and that, and I know we're getting, but are you okay discussing this? Because I think it's so
Sure.
interesting. You have so much knowledge that while I have you, I might as well just, I know they're not on the list, so I'm sorry, but all these things come into my head while I'm listening to you. And, the goal is to give women so much information because I really want them to understand what's going on because, I'm sorry, but their doctors aren't telling them. Even their OBGYNs really aren't telling them. But anyways, testosterone, some of the doctors will talk about the estrogen progesterone balance as we age and it's dropping off and may even support a patch or a cream or something like that. But then, you mentioned testosterone and they get a little bit like, whoa. And I realize that there's not a lot of studies out there on women and testosterone, but it is a very important hormone for us and we have a fair amount of it. You do. I don't understand why they're so adverse to talking about it or afraid to talk about it because we just talked about strength training. I mean, it helps us retain our muscle, build muscle, keep building, retaining your libido, your mood, fat loss, all those things. And obviously brain health and the cardio health and bone health. But what is your opinion on, on women using a little testosterone? So full disclosure, I'm on hormone replacement therapy. I'm taking estrogen, progesterone. I use a testosterone cream at night, very little, just a little bit, and I rub it in my forearms. And then I'm using some Armour thyroid. My thyroid was okay. I didn't have any, but my doctor's like, I want you, we want to optimize. We want to be on the far end of the range, not in the middle. But I'm just curious what your opinion is on women using testosterone.
It's funny. I had a bit of an epiphany there. So a lot of the female practitioners, functional medicine presenters, we've kind of aged together. So they're in that menopausal, postmenopausal stage. And 15 years ago, quite frankly, they're like, I wouldn't take hormone replacement. That's ridiculous, et cetera, et cetera. Well, it's kind of like making fun of the kid with gray hair. And now you're 55 and you're looking for some dye. Life looks different when it stares you right in the face.
Right.
And a lot of them are on replacement therapy and they're getting tremendous benefit from it. They're not losing the bone mass. And they're on, like you said, a very low level to modulate. Virtually everything other than the Armour that you were talking about. And they said it really precipitously dropped their bone mass, which is a true concern with women. Women lose a lot of bone mass by the time they're 40. Men actually catch up. But nevertheless, osteoporosis, osteopenia, it's a problem again. Good diet, good lifestyle, weight resistance, add to longevity of your bones. So I'm a proponent if the numbers bear it out via blood serums. Now, we flick the switch to the guys in the TRT. I'm fine with guys taking TRT. Here's my issue with them. The numbers are sometimes skewed. And, the women listening, their husbands are probably discussing this with them. A lot of guys come in and, the doctor says, are you tired or are you not like you were when you were 18 years old? Memo, It's not the same. You know, if anybody doesn't know that, give me a call. We'll have a little lesson. We'll have a little honey, a couple of bees, and all sorts of things like that. Nevertheless, um, they'll come in with a level of like 300, let's say, which is at the lower end. And they may need a little, they may have the middle age spread, the middle age drop. So my suggestion for the men, because that's what I see a lot of, is to detox, try and lose a little weight, add a little weight resistance, drop your sugar, and let's see where we go. And I see people on that type of protocol increase about 200. So they go from 3 to 500. Then at that stage, they can decide, do I want to push the envelope a little more? Do I want to go to 7 or 750? So flicking the switch back to the women, it's the same thing. Not, does every woman need it? No, but it's there and it's viable. I mean, I'm going to use the word drugs, but they have their place. And when utilized well, they're extraordinarily effective. I think the problem with the idea of drugs, we are in America, when it comes to drugs, 4% of the world's population. We use 52% of the prescription drugs in the world and 80% of the pain drugs. I think the numbers speak for themselves.
Wow.
However, that doesn't mean using a drug is a bad thing. It's just got to be used appropriately, and the serum numbers have to warrant it. So I'm all for it as long as it checks the box.
Absolutely. And just from my own personal experience too, and being on hormone replacement therapy, just because I just started, we usually look at blood work about every 60 days. It's been since I started, just to see, what's happening and raising levels, and, my sleep is still so we raised my progesterone. It might be getting a little bit better, but I agree with you. But just reading so many of the studies and really understanding it, and being at A4M and a lot of the doctors that speak there about hormone replacement therapy, without naming them, who I'm talking about, but it's exciting to see that there are very renowned doctors like yourself and some of the others that we listen to. I actually did a podcast with Dr. Jacobson, who's in the space, who is my doctor. We talked all about it, but it's good to see that it's out there for women. And yes, I really want them to understand the benefits, and being with the right person that'll do all the, the serum testing and all that to really see where you're at, versus just stuffing some pellets in and being like, okay, see you later. So it's an exciting time. And it's exciting because if you find an OBGYN, mine is definitely open to it, which is great, but they can also prescribe and help you too. So it doesn't have to be out of pocket. Insurance will cover some of it. So it is refreshing to see that we have the options, that we don't have to suffer. So that's always my message, is that, ladies, there are options. So you just have to find the right ones.
I agree.
So
you always have to have your treatment individualized for your needs, your goals. So you're my N of one, and that's what I tell everybody. So these are generic questions, but you need to sit down with a comprehensive, functionally oriented, a collected physician who's looking at your needs, not the group itself.
Right.
And if they do that, you're going to get a great outcome and you're going to get a good answer.
Exactly. Well, thank you so much. Now, I want you, if someone wants to work with you that's listening to this, that may want to come and see you to talk about their gut health or anything else, because I know you do lots of other things, not just gut health. How should they find you? Do you want to give us your Instagram or another way that they can reach out to you if they want to make an appointment with you?
Absolutely. I'm in White Plains, New York. Dr. Rob Silverman. My Instagram, my Facebook, my LinkedIn is Dr. Rob Silverman. Follow me, DM me. Love to hear from you. If you ask a question, I'm there.
And I will also type it in the comments too, so people can see it when I post it. And don't forget to pick up his book too, Immune Reboot. You can get it right on Amazon. It's a great read. And there's a lot of really good information in here. So it's definitely worth educating yourself, ladies and some gentlemen that may be listening, about gut health and how it really affects your overall health too as we age. So thank you, Dr. Silverman. I really appreciate your time.
It was my pleasure to be here anytime. Just remember, take care of your body. It's the only place you have to live.
Thank you.